Good afternoon, everybody. I'm Priyanjali, your host for today's live from All About Skin Wellbeing team. I'm sure all of you must be keeping good health. Today, we are going to discuss about our skin health with focus on urticaria or hives, which we or our near and dear ones have must have encountered at any point in their life. It may be due to chemicals in certain food, allergy in certain medications, insect stings, sunlight, and sometimes the cause is unknown. As per study published in Indian Journal of Dermatology, Venerology, and Leprosy, more than one-fifth of the population suffer urticaria at one time. 60% of the patients are in the age group of 20 to 40 years, and incident is higher in older age group. Urticaria is classified as acute and chronic. But most important part is not to ignore it, and doing self-medication can worsen its symptoms. Consult your nearby dermatologist immediately for an early remission. In today's digital world, it's a boon or blessing if we can get to hear from an expert dermatologist online about urticaria, its types, how we can prevent it, and the kind of test required for its diagnosis, the right treatment and management approach for an early relief. So, ladies and gentlemen, girls and boys, we have with us renowned dermatologist of India, Dr. Tushar Jagtap. He's a dermatologist practicing in Bandra East, Mumbai. He runs his own clinic called Dr. Tushar Zen Clinic located at 2 by 13 Amrutnagar, Kherwadi Road, Bandra East, Mumbai. Dr. Jagtap offers a wide range of dermatological services and products to cater to the varied requirements of his patients. He is highly skilled in his field and has received positive reviews from his patients on platforms like RateMDs. He has years of experience in this field, and his skill and compassion has made tremendous difference in patients' life. A warm welcome to Dr. Tushar Jagtap. It's a pleasure, doctor, to have you here with us today as we are going to discuss on a very important topic, which is the management of urticaria. So the first question which I would like to ask you, what is urticaria?
Priyanjali, thank you very much for such a gracious introduction. And thank you, everybody, everyone on this platform. I'm very happy to be here. I believe in information, education, and communication. And the topic which you have chosen is very pertinent in today's times, especially because if you see in city like Mumbai, where I'm practicing, and or even to many cities in our country, because of even if we have rains, there is a lot of humidity. There is a rebound humidity, I can say, and that is triggering a lot of skin problems, and especially urticaria, or we call it as a cholinergic urticaria, is a one thing because of humidity and the sweat. So you ask me what is urticaria? See, urticaria is a skin rash, which we most of the people they get, as you said rightly in your introduction, that one-fifth of the population they suffer with this. Now the question is that there are well demarcated or undemarcated circumscribed patches on the skin. They may be papular, that is raised, or they may be macular, but they are intensely itchy, and they can appear on any part of the body. But usually it is seen on the trunk, on the hands, and if there is an involvement of the mucous membrane, especially larynx and lips and the eyes, then you get something called as what we call it is a deep-seated or deep-based urticaria, also known as angioedema, and that's quite severe. So one has to be very careful when it's most of the time it is self-diagnosed. That patient they come, most of them they know. Uh, but in today's times, what I see is that in spite of the penetration of internet, or in spite of the penetration of, you can say, digital space, most of the younger lots, actually that is the age group which you also mentioned, between 20 to 40 age group, they are oblivious to this. Okay, what could be the cause? And one reason may be that most of them, they are staying in cities, they are migrated from their natives or from other places, and there is no good support system. So I do see cases where patients really don't connect with their skin rash. They don't know what it is, which was not the case a couple of decades ago. But anyhow, this rash which you get in the body, that is known as urticaria. It could be because of allergy to food, as you mentioned, allergy to certain drug products, inhalants also. Your additives also, especially we have a lot of food which we call it as a junk food, even that can cause allergy, even some infection. So urticaria is basically a rash which you develop, itchy rash which you develop on the body. Most of the time it is red in color or erythematous, what we say, and there is a flare. And when it comes, keep it. There are two types of urticaria. One is as far as the type is acute urticaria, where you immediately develops a rash after say 20 minutes or half an hour. In some cases, maybe prior to that, and it lasts for say few hours, few minutes to few hours, and it disappears. But if the urticaria or the rash it lasts for more than 6 weeks, then we term it as a chronic urticaria. That is a time duration below 6 weeks and after 6 weeks. But usually the acute urticarial rash it disappears in say a few hours, and it may recur also if there is a stimulus which triggers the immunological reaction. So this is what urticaria is in nutshell. Thank you.
Right. Doctor, the main issue with any kind of condition or disease is identifying it. So, how does the initial stage look like? How does one know that this is urticaria and this is the time we should visit a dermatologist?
The very good question which you asked. See, there are types of urticaria. Like there is a physical urticaria. Physical urticaria which you will get because of the pressure or because of the heat or because of cold, because of scratching, because of most of the times I see people wearing very tight clothing, especially their inner clothing that it's quite. So that may in those who are prone to get a physical urticaria, it may happen in those people, in those cases.
Hmm.
Also, a doctor has to take history of drug injections, history of infection. Now there are certain drugs which I feel that the viewers should like to know, which are the drugs which are incriminated in or which are, you can say, they are very prone to cause allergy, and they are sulfa group of drugs, penicillin group of drugs, something we call as a non-steroidal anti-inflammatory NSAID, that which is commonly we take OTC from the medical store, Combiflam, or I would not take the name, but ibuprofen or paracetamol, or even your diclofenac. These are non-steroidal anti-inflammatory drugs. They can also they are incriminated in this. Certain food articles. Now, what are the food articles which we commonly consume? Milk is one. Milk, egg, wheat, spinach, tomato, and eggs, cheese, mayonnaise sauce. So many. There is something which medical fraternity says that anything under the sun and into the sun can cause allergy, can trigger this urticaria. So you have to be very careful when you develop such rash. When you develop these things, you have to know what you have eaten. Something straight like shellfish. I have a friend
Hmm.
who's a doctor, who's a pediatrician,
Hmm.
and one he had this prawns, and he developed a severe form of allergy or urticaria, and it was known as even anaphylaxis. See, this is a very important thing which you have to remember, that sometimes it can trigger anaphylaxis, which is a medical emergency. The patient has to immediately rush to to a major hospital, and where usually in an anaphylaxis they give a shot of epinephrine, and that is how it is treated, but it can be life threatening. So one has to be very careful. Your question is that how do you diagnose? So there are a number of other skin conditions which sometimes mimics like urticaria. Even you have atopic dermatitis, or you have many allergic and non-allergic disorders. So it is a clinical at at an individual level and the patient's level. The patient would immediately understand once he develop a red rash on his body, which is itchy, which is giving him. Sometimes they can get a stinging and a burning sensation, and that is how you can rush to the doctor. Thank you.
Right. Well, I think this is one issue which most of us have faced at any point in our life. So there is another cause behind the urticaria, which is sun, and it seems very scary that we cannot go out in the sun. Anybody who goes out in the sun, they can have a urticaria from the sun. Also, there is another kind of urticaria which I personally have seen in my life. A friend of mine, he could not, go into the rain. So rainwater was causing him urticaria. So just the same way, water can also be another reason. So how scary is that? How does the patient deal with it, and what are the diagnosis for such kind of
Yeah, yeah, this is
causes?
very interesting. What you asked me, solar urticaria and aquagenic urticaria. Aquagenic
Mm,
is that is
mm,
water-induced urticaria, and many patients they develop allergy to cold or even to the sun exposure. Some patients, as soon as they go out, they can develop sun allergy. Now, there are two approaches to this. Once you know that you have a sun allergy, the best thing is to sun protection. Now, what is a sun protection? There are two types of protection. One, you have a physical barrier, like physical barrier you can wear is cap or umbrella you can carry, or young girls usually wear stone. That also helps them to protect. Or there are a number of sunscreen agents which are indicated, which can be applied. But one has to remember, if you have to apply a sunscreen agent, you have to apply it at least 15 minutes before you go out in the sun to protect yourself from the solar urticaria, of the sun allergy. And in that, what is it that causes? So there is an antigen formation on the skin because of the the wavelength of the light. And those who are prone to get allergy, they develop a solar urticaria. Certain prophylactic measures can be taken, and which might help after consulting your dermatologist or allergy specialist. Similarly, in cold also there is like you asked about rainwater.
mm.
So what's important is that what you have to understand that rainwater we feel it is free of any contaminations. But yesterday only I saw a video in that they showed that the rainwater contains lot of microbes.
Right.
Till now, we used to consider rainwater only in form of its temperature. Like suppose it is a cold,
Mm,
so that is what aqua, that is water, agua, that is water, which causes allergy. But now I yesterday, this is my yesterday's belief. Yesterday when I came to when I saw this video, there was a 400x magnification in that under the microscope when a raindrop was examined, and they found a lot of
right.
bacteria. So that could be one of the reasons why patients develop allergy.
Right. Right. So, for patients who have serious issue with rainwater, what is the best possible solution? About solar urticaria, you have already mentioned that sunscreen can be a reason, can be a way how we can protect our skin. Also, physical covering with a cloth or anything particular when we step out in the sun can be a way to stay away from it. What about rainwater? How can we protect ourselves in case? What if the person जैसे कि अभी आजकल का मौसम का हालत है वी नेवर नो व्हाट द weather is about to I stay in Kolkata so it can be raining just 5 minutes before and at this moment we can have the temperature exceed by 5-6 degrees so we don't know how the climates are changing nowadays. I'm just talking about my place but the same goes for all the places in India. We are facing rainfall, we are facing sunlight. So what if koi bahar jata hai kaam ke liye and then all of a sudden raste mein barish ho gaya and then the person again serious issue ho ja raha hai and he can see some lesions on his skin. So how does a person deal with it?
See, there are two things into it. One is he has never experienced allergy or urticaria, and second
Hmm.
to water, rainwater, and second he knows that when he goes and gets wet, he develops an urticaria. Now the first
Right.
case really he has to go and see the doctor immediately after he develops urticaria. But in the second case, as a prophylactic measure, he can take a certain second generation antihistaminics. And by second generation antihistaminics, I mean that the antihistaminics which are available, there are two types.
Hmm.
One is first generation, which the difference between them is that the first generation antihistaminics which used to use in the past, like hydroxyzine or or chlorpheniramine malate, they crosses the blood-brain barrier and they causes sedation, a lot of sedation, or even diphenhydramine, which is the first generation antihistamines. So he has to take a non-sedating antihistamine. So his day-to-day activities are not hampered with. And in that case,
Mm.
the trigger which he gets because of getting wet in the rain, could be prevented, or could be, the severity of the allergy response could go down drastically.
Right. Doctor, you have mentioned about the diagnosis that we know the history of the patient or the kind of food the person has had or the place where he have been, and then we try to know the background of the patient in order to do the diagnosis. But what are the treatments currently available? Technology has advanced like anything, and I'm sure that the treatments have also been, advancing with time. So currently, what are the treatments available for both the urticarias, acute and chronic?
Okay, thank you. And before the treatment, I think we should come to investigations. And
Right.
before the investigation, also we have to come to the history of the patients. So
Hmm.
the patient needs to be well examined also, and his detailed history, like his history, his family history. Family history is important because it is seen that patients with a family history do
Hmm.
there is a more prevalence of getting allergy. Like if the parents they have allergy, one third chances are there that their children are likely to have the allergy to the same product, like to the same
Hmm.
drugs for that matter. And then what you have to see is that whether the patient, in the history, you have to see whether the patient is having any hormonal problem. Like thyroid hormones is very important, which can trigger allergy, which can create allergy. Then the makeup of a patient, emotionally, I would say, charged patients. They not charged. That is not the right word to say, but people with a lot of emotional people, they will tend to get more allergies. That is what I want to say.
Hmm.
And then investigations. Investigations, you have to have basic investigations, like we can complete blood hemograms and ESR and this total count, eosinophils, basophils, urine routine examination, thyroid examinations, liver function tests. These are the baseline investigation. IG, serum IG, which is very important, and which is available in our country now. That serum IG levels gives an indication to the doctor what is the level of circulating antibodies, so that the doctor can get a hang of it and then treat the patient accordingly. So these are, you have to rule out the infection part of it. Like any
Hmm.
infection anywhere in the body. Suppose
Hmm.
you have sinusitis, or you have sore throat, or even any viral or fungal infection or bacterial infection, that can dental infection also that can trigger urticaria. X-ray test is very important. These are the baseline investigation. X-ray test is also important to rule out any foci of infection. So this kind of investigation which we should do, and then we can have specialized investigations, which really tend to be a little costly, but then that can be asked for in certain cases. Even there are certain severe conditions like mastocytosis or so and so forth. In that you can have ANA, antinuclear antibodies test to be done, and this serological test helps in diagnosis. So you have a number of tests which one can carry out as far as investigation, the history taking is concerned. And now you are talking about the treatment component. Saying treatment, avoidance is the best.
Hmm. Hmm.
We say that prevention is better. Prevention is better. So avoidance is the best line of a treatment. In mild urticaria, or say sometime with pressure urticaria, after we do this test known as dermographism. Dermographism is we stroke the skin of a forearm with a blunt cotton cotton tip sharp instrument, and not cotton tip, with a wooden sharp tip, this thing stick, and you get a triple response of Lewis, where we understand whether it is a physical urticaria or non-physical urticaria. And there you don't need to do many tests. You can assure the patients one or two, one simple antihistaminic definitely helps. Antihistaminics and oral steroids, they are the foundation of the treatment in urticaria. In antihistaminics, I mean to say H1 antagonist. These are the receptor H1 and H2. So H1 antagonist, that you have first generation antihistaminics and you have second generation antihistaminics. Now most of us know, we have heard about the pharmacology, these trade names, but I would say fixofenadine is there, loratadine is there, cetirizine is there, levocetirizine is there. Uh, these are the second generation antihistaminics which can be used in prevention, and in some cases where we want that the anxiety component to be relieved, hydroxyzine in the first generation, which is very good. But the only thing is that in some cases it may cause a lot of sedation. So you have to educate the patient about the effect of the drugs. And one thing I would request on the doctors also, and those who are listen to this Facebook live, that whenever you take any antihistaminic, see whether you get sedations with that. Even if non-sedating antihistaminic could cause sedation in some patient, and so driving is no, you should not drive if you are handling a vehicle, four wheeler or a two wheelers, and you should never take alcohol with that
Hmm.
because they interact, they react. And I know a friend of mine who unfortunately didn't realize it. He had taken antihistaminic in the morning and he consumed alcohol in the evening, and then there was a lot of problem for him. That he developed, almost anaphylaxis like reaction. So one has to be very careful. The doctor must tell at least 24 hours in advance before you take this medicine, or 24 hours after you take the medicine. Please don't take alcohol. And so these are the two main things. Then in some cases, suppose in some refractory cases, like we see in chronic urticaria, in chronic urticaria, most of the time you don't find the cause. And in that case, you can imply in some cases H1 and H2 antagonists, H1 receptor and H2 receptor. So it helps. And then there are simple medicines like ranitidine is there, famotidine is there. Or previously, we used to cimetidine, which used to be a very good immunomodulator also, and we used to help, and it used to help in urticaria cases. So these two things, and I will talk about one drug which is known as doxepin. It is a tricyclic antidepressant medicine. It is one of the drug
Hmm.
which is a drug of choice in certain patients because this single drug has a property to interact with both H1 and H2 receptors. So doxepin under medical prescription, preferably in the night, is a very good medicine for patients and all patients whosoever wants to take any treatment because in our case, this self-medication has increased and after the spread of social media, YouTube and Facebook and so WhatsApp and so many other channels, patients or popping the pill by themselves has increased drastically, and that we have to be very careful because there are certain drugs which interact with each other. There is something known as drug-drug interaction, and in that case, suppose drugs which are toxic to the liver, and if you take them with antihistamine, there are chances that the absorption of the drug and the side effects will increase. So one has to be quite careful when you self-medicate yourself. So in this, these
Right.
are the few things: antihistaminics and steroids, and in some cases, local soothing agents, or even cold water helps a lot in relieving or alleviating the symptoms. Thank you.
Right. Well, doctor, I mean, we are talking about the medications, the treatment procedures, because we definitely want to educate our audience today. But how worst can self medication be? Or we have a lot of people nowadays, they'll just visit the pharmacy, they'll go to the chemist and they'll ask the person कि देखिए ऐसा ऐसा हो रहा है, क्या दवाई लेना चाहिए? Or we also see a lot of people that my neighbor or the person whom I know is having a same kind of condition. So the person, whatever medication he or she is taking, I will take the same. So we see these kind of scenarios a lot. So how worse can self medication be in the case of urticaria?
How worse the self-medication can be, I can tell you one thing which a patient narrated to me. Unfortunately, because of the self-medication and the patient who took the medicines on his own without consulting any doctor, and she developed a severe allergy to that. So much so that she was in ICU for almost a week or so, and it was very lucky she survived luckily because what happens, the drug allergy is not diagnosed most of the time by the practicing doctors. And in India, we have various streams of doctors practicing. So to identify whether this patient has developed a allergy to certain drugs, many pathies they do not know. And in her case, same thing happened that she continued to take the same medicine, thinking this is such a innocuous medicines. Nobody develops allergy. She never got a hang that it is her problem was mainly, and even most of the doctors who missed the diagnosis, eventually she was landed in the ICU. So I
Hmm.
can tell you, self medication can really cause life threatening issues. This is and one has to be very careful. Even a as small tablet as acetaminophen, which we take for fever, no drugs should be taken without
Hmm.
a medical supervision. That is a because one life loss is very terrible loss for humanity.
Right, right. So, for the people who are suffering from urticaria, who are visiting a doctor, who are under a consultation, uh, for them also we get to see a kind of scenario that they are taking a medication. The doctor has referred them, and they have gradually cured. And after a certain period of time, they see the condition occurring again. So, reoccurrence of the condition is there. uh, and at that moment, with what we see them doing is self medicating themselves. So they are like, डॉक्टर ने हमें पहले बोला था, यही दवाई दिया था डॉक्टर ने, and all we have to do is take the same medication again. So can that also be harmful?
Usually what happens, this is a tendency. I mean, in my practice I can tell you that there are patients, they can come with some 10 years old prescription and say डॉक्टर आपने ये दवा तभी दिया था बहुत
Hmm.
अच्छा था, अभी वो नहीं मिल रहा है करके मैं आपके पास आया हूँ. So
Hmm.
this is interesting that the patient is not able to find the same medicine. That is why he is
Hmm.
visiting you, because he is, so he must have taken, he or she must have taken that medicine for empty number of years. Whenever they develop this practice, ideally, what I say is our setup, it is very difficult that you say no, you don't take that, because every time the cause may be different. The symptoms may look
Right.
like same. In skin, one thing I can tell you, and I want to tell everybody who is on this platform, that one rash can mimic 10 different diseases. The rashes are
Hmm.
so, and it is altogether different. That in our practice, we as a dermatologist, we have to see the lesions. And if you don't see the lesion, then we will miss. And so in our patient, most of the time the patients are very shy. They do not want to show the lesions if they are at awkward places for them. But then the chances of missing the diagnosis is very high. I can tell you there are
Right.
certain viral infections, certain bacterial infection, certain fungal infections, certain drug allergies, and even certain parasitic infection could be missed, and they are missed by many, even by the physicians, because we really do not examine the patient as told to us in our Bible, known as Hutchison. That was a book of physical
Hmm.
medicine, basic medicine, which we learned in first MBBS. I would request that most of the doctors they should reread Hutchison, and they should practice at least part of it. Of course, with experience, you don't have to do so much, but we should not SOP, that is standard or SOP. We should not forget the SOP. We must examine the patient properly, and we educate the patient. See, educating the patient is
Right.
very important, and not only doctors. It is what I feel
Hmm.
now. I feel it is doctor, his receptionist, its staff, the staff in the hospital and the staff in the laboratory, and even the medical stores from where they procure the medicine. This
Hmm.
ecosystem should properly guide the patient. What are the do's
Right.
and don'ts? And I think
Right.
if we could, do this kind of networking, then many patients they will benefit by that, and we will definitely
Hmm.
reduce the chances of health accidents. Thank you.
Right, right. Doctor, you initially mentioned that there are family histories which are seen when we are talking about urticaria. So, is it also contagious? Can it be spread by touch? Is it possible?
No, please come again. Is it what you said? Please come again.
Is it contagious?
No, 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 no. That is one thing which is very interesting. That people really want to know whether it is contagious. No, this is not at
Hmm.
all contagious. It is an allergic condition. So one important thing in allergy is what many patients say. Suppose this is urticaria, but then there are certain dermatosis like palmoplantar keratosis, or even psoriasis, or even for that matter, so lichen planus and so on and so forth. Other skin conditions which are allergic in origin, but there are visible lesions on the hands or on the body, and the patient is very much worried when you want to shake the hand with somebody. So remember, allergic conditions are not contagious.
Hmm.
So
Hmm.
one has to be very careful. So you once they know that it is not contagious, half of their problems get relieved. And one more thing I would like to Priyanjali say here: if you develop any kind of allergy or if you develop any kind of a problem, especially in skin, the best medicine, even it is a best medicine in emergencies also, I'm saying, it requires
Hmm.
only 45 seconds. You have to stand, you have to sit upright like this, like I am sitting, and just close your eyes for 45 seconds. And if patients can observe this technique, this is a proven technique scientifically. It reduces the antibodies, it reduces the allergy. It's a very helpful technique. And what happens as soon as you close your eyes, as soon as you get in a upright position, like you see in army, that the way they stand, eye attention and close your eyes and keep quiet, your brain waves. There are patterns in the brain. What the active pattern which we are discussing and everybody is listening, or I'm listening, you are also listening, you're speaking, I'm speaking. That is known as our beta pattern. That is an attention pattern. But as soon as you close the eyes and you sit in an attentive position, you go into something known as an alpha state. And once you go
Hmm.
in an alpha state, all these allergic reactions and your immunological reaction, they start settling down. And I would say that many of us can take advantage of this practice, which helps you. And if you practice it on a regular basis, nothing like it. Thank you so much.
Right. Well, it was a beautiful learning from you today. I think we got to learn a very nice thing from you. Speaking of that, doctor, can stress be a trigger for urticaria? Because we know stress can trigger a lot of diseases, some diseases which can be diagnosed, some diseases which cannot be diagnosed. So, can stress also trigger urticaria?
Very much. Very much. In today's Mumbai, especially, I see patients. Most of them they are under some kind of deadlines, goals, and there is something going on in your mind. And I ask them, ki, what is OT? So I'm asking you, what does OT stand for? Tell me, Priyanjali. In you, it's a short form. What is OT for you? ONT.
According to the medical language, I know Operation Theater is it, but
That's nice. Yeah. Please go ahead.
that's all I know about OT. But does it have any other meaning? I have. I'm not sure.
Yeah, I'll tell you. See, OT in previously, if you ask the few decades ago, everybody would say overtime. But OT does not stand
Overtime.
for overtime anymore. Now OT is overthinking.
Hmm. Right.
And I can tell
Absolutely.
you 40 to 45, 40 to 50% of patients whom I see in my practice, this is a very important ingredient. They are all anxious. So what is anxiety or
Hmm.
what is anxiety can trigger urticaria. As you said, stress. What is stress? Stress is also a part of anxiety. What is anxiety? Anxiety is a chronic or acute thoughts you get, worry or fear, chronic or acute, repeated chronic or acute worry and fear about something or someone. That is anxiety. And with anxiety triggers the chemical reactions in the body. And that is how you can get urticaria and so many other problems. So one has to first deal with his or her anxiety and stress is directly implement. I'll give an example how stress can cause a very severe urticaria or a very severe problem. A patient of mine, she went to receive her son at Santa Cruz Airport. That time it was Santa Cruz Airport, and he was supposed to come from abroad. She went there to receive him, and that time there was no mobile services. So all the passenger got deboarded or alighted from the plane. Her son was not there on that flight, and she got a shock of her life that she came to receive him, and he's not there on the plane. So suddenly she developed huge rashes on her body, and she started getting breathlessness and developed swelling on her lips. Her husband, who was also my patient at when I was practicing, so he rushed her to my clinic. And then I spoke to
Hmm.
her, and then I talked to her, and then I gave her a lot of assurance. And of course, later on the medicine, her this thing subsided. Important thing is that see this acute emotional exacerbation that she got scared that why her son has
Hmm.
not been is not on that plane. So any kind of an emotional reaction or emotional stress or positive or a negative emotion, especially fear, anger, can trigger allergy, and one has to be very careful about that. And you said stress, yes. What happens with stress? Everybody says what happens with stress. With stress, what happens when you don't? When stress is basically when we need stress, when we need those hormones, that is cortisol and adrenaline. When we are in a life-threatening situation known as a fight and a flight response, either we can fight it out the threat, or we have to run away from the threat. That is the time when we need these hormones. But if you start repeatedly getting anxious, worried, nervous, depressed, a lot of commotion in the mind, then those hormone
Right.
secrets get secreted, and because of that, it triggers reactions, and you can cause a degranulation of mast cells and release a histamine, and you can get urticaria. Thank you.
Right. Doctor, because we are talking about stress, I mean, lifestyle changes has changed drastically nowadays. People, they don't have any time. I know a lot of people who does not see the early morning rays, so basically they are getting up in the noon, they are sleeping late nights. Phone is one of the reason, work pressure is another reason, peer pressure is another reason. So basically nowadays we also see children such young age, they have a lot of pressure. They are maybe it is work pressure, study pressure, or parents pressure. uh, there is a lot of stress around nowadays. How are these lifestyle changes affecting our health, and can this also be related with urticaria? Does unhealthy lifestyle somehow trigger urticaria as well?
Yeah, very much. You said about yeah, what I observed in Mumbai especially is that as you said that people they work as per the international times. So many of them have never seen sunrise. Neither we see
Right.
sunset. Neither we visit to
Hmm.
park. Neither we visit to seafront. In Mumbai, there is want of flora and fauna, especially jungles, where we should go
Hmm.
to the woods on the time. And I tell my patients that at least once a week you do that. It is observed that vitamin D deficiency triggers urticaria. So when you said about
Hmm.
lifestyle is the key component in any diseases. See, there are
Right.
seven universal doctors which I would like to communicate through this conversation. One is a good sunlight, good
Hmm.
sleep, keep
Hmm.
smiling, balanced diet, be
Hmm.
happy go lucky, have attitude of gratitude, and keep exercise. There
Hmm.
is no substitute to exercise. I can tell you
Right.
for most of
Absolutely.
the time, and all these young. And second, now you have to have a very good ecosystem. Like you have to have good friends, good seniors, good colleagues, good family atmosphere. I have seen people are not sharing their critical problem even with their parents or even with their best of the
Right.
friends, and they're
Right.
brooding inside, and that is creating a lot
Mm-hmm.
of. I can see the patient, and I know this patient is what he's going through because his skin will be dark. There will be under eye dark circles. And you can find a kind of cynicism in them. So when you say cynicism, there is a lot, there is a chance that the patient may have vitamin deficiency, especially vitamin B12 deficiency, and uh,
Hmm.
that his lifestyle or his mental, emotional, and physical health is not in accordance to his age and his his personality. So one has to be very careful. So come what may, you have to give 40 45 minutes to yourself. 30 minutes for exercise and 5-10 minutes for your basic meditations. I say forget meditation,
Right,
at least sit
right,
quiet for 5 minutes.
right,
So stress
right,
plays a
right.
lifestyle plays a very important role.
Absolutely, absolutely. I mean, these are the basic changes which, if we apply in our life, I think a lot of problems will be solved. It's just not about urticaria, it's about a wholesome development, a
Yes.
wholesome balance of our entire body. Because we are talking about this, because we are having such a wonderful discussion about urticaria and mental health and overall health, exercise is something I believe people are nowadays so stressed. Day before yesterday, I had a person uh, too much stress in his life, whatsoever reason. Uh, I think exercise is something which can release a lot of your stress. Doctor, what do you have to say about this? Also, another question for you would be: what if the person is suffering from urticaria? Can exercise be suggested to the patient?
I'll tell you very interesting. Actually, Miss, I'll tell there are two things. Say exercise. Now,
Mm,
something which is very important, that exercise you have to do. There is no second thought about it. But start have moderate exercises. You
right.
begin with the moderate exercises. And one piece of advice which I would like to give you to all the patients, those who are hitting the gym, especially gymnasium, or
Mm,
those who are into vigorous exercise, it is advisable not to eat 4 hours before exercise, and
four
especially certain
hours.
food articles 4 hours before, especially certain food articles which could trigger urticaria. See, we
Mm,
have seen many cases where you see many patients suddenly they collapse after when they were jogging or they were doing some exercise in the gymnasium. What it is? It is something known as exercise induced anaphylaxis, and it happens in
mm,
certain cases. So patient has to be very careful. And this one piece of advice, that please avoid having foods which could be urticarogenic, and or at least 4 hours before you go for an exercise. Please don't eat. Please don't eat as much as you eat, or otherwise, please don't eat, because most of us
right.
let the stomach be empty. Let
Mm-hmm.
the stomach be empty. And I think what you said, that generally I tell all my patients to do basic exercises like stretching at home, or the dips and Surya Namaskar and dumbbells and all. But heavy exercises, one has to be very careful. One should know that every gymnasium, through you and through your this and through this discussion, I would really request all the gym trainers also, and all the gymnasium owners and people who are going for gym, that every gymnasium should be equipped with something known as epinephrine pen. What is epinephrine pen? Epinephrine pen or auto or it is a, you can patient can also take it. If you develop allergy, if patients have got say rash on the body, or he started getting itching, or he started scratching his body, or there is difficulty in breathing, or there is difficulty, or there is swelling, immediately is an epipen, which is a medicine known as epinephrine, which can be given to this patient, because they develop a lot of hypotension, tachycardia, and patient, many accidents have taken place in the gymnasium. So the gym, I would request the medical fraternity also, and the health industry, that like in most of the casualties we have this emergency drug. Similarly, we have this DC fibrillator at many places where the patient gets into cardiac arrest. We can use those DC fibrillators. Similarly, this EpiPen could be kept in a gymnasium, and it can be used by a trained person in case of emergency. Thank you.
Right. Doctor, speaking of that, you mentioned diet. Diet is also another important thing in our life. Uh, because we are talking about urticaria here, what kind of diet should we suggest the patients? Is it normal diet and avoiding the triggers, or
There are certain foods, which are rich in histamine. So one kind like spinach and tomato, one should try and avoid if you are prone to get allergy. Basic
Hmm,
food, what we Indian eats, I think that's good for us. But shellfish, if you're allergic, if there's a family history of allergy to shellfish, or the patient should try and avoid it. Peanuts, they are one of the common
hmm,
allergens. Then citrus foods. Citrus food is one thing
hmm,
which usually tend to cause allergy. You have I tell my patients to avoid anything they know. The family members. I have a friend who suffers allergy to mayonnaise sauce, egg. So if you are allergic to certain food articles, wheat
Mm.
also, you should avoid that particular item as far as possible. And then you can go and visit the doctor so you can take certain medications. One of my patients is a professor and she developed allergy only to tea.
Tea.
So when I had done a skin allergy test where you almost test for 200 skin prick test, her only one thing came out is tea and she had to stop tea then. And she's a professor.
Mm.
So, you see,
Right.
anybody can develop any allergy to any substance for that
Absolutely.
matter. And one has to be very
Absolutely.
careful to understand what he or she eats. Thank you.
Right. Doctor initially mentioned keeping your stomach empty can be beneficial. A question out of the context, a little out of the context, maybe. Uh, how can fasting be beneficial for an average person, or is it beneficial?
Fasting is very beneficial. How you practice, how much you practice, that's very interesting. I remember my mother used to fast every week, once in a week.
Mm.
I on Wednesday she used to, Thursday she used to fast. Once I also fasted, and then I realized you have such a energy, you get such a tremendous energy.
Right.
If you fast for
Mm.
say 24 hours, 18 hours, and there is something known as autophagy. One of the Japanese doctor, a scientist who got a Nobel for this. Autophagy is that if you fast for a long period of time, the body starts eating its own dead cells or damaged cells. So it is one
Mm.
of the very interesting and fast in Indian tradition. Fasting has been observed by most of our philosophers for thousands of years, even sadhus and yogis. And there is no
Right.
substitute. I think fasting is a very useful technique one can incorporate in his or her lifestyle. And at least once in a week one can fast, or there are something known as you can have 16 hours fasting, 18 hours fasting, or 8 hours, 9 hours, but fasting in a way helps. And in Japan, they do this, they know something known as harahachi ban. Harahachi ban means what? They say ki don't fill your stomach to the brim. Keep it
Right.
20% less. That is known as harahachi ban. So for if you want a healthy, long, active, and long life, one of the ingredients in that Japanese technique is harahachi bone. Means eat 20% less, 20% less breakfast, 20% less lunch, and 20% less dinner. So that helps, and that reduces the incidences of allergies also, and urticaria also. Thank you.
Beautiful, beautiful practice. Doctor, again, coming back to the topic, what if the patient is not getting treated or not treating himself or herself? What are the possible complications if left untreated?
If left untreated, which is see, this is very interesting. Which if left untreated, I sometimes feel that some most of the time the medical fraternities they are tablet driven or injection driven. Body has a potential to take care of itself, and
Hmm.
those patients who do not want to take the medicine, there are many patients who do not want to take the medicine. They can try say applying water on their body or cold water, or sometimes they feel better with even hot water. So it depends from case to case. I, if a patient of fatigue comes to me and he says, no doctor, I don't want to take any treatment, but I want to you tell me what it is. I say, okay, this is a urticaria, and he says, I don't want to take. What would happen? It's a very interesting question. I think ultimately the urticaria will subside if it is acute variety or even a chronic variety, which is unlikely to get into anaphylaxis, which is unless he continues to take the same thing, continuously get exposed to the same allergen, then he might develop a severe problem. But otherwise, if he avoid it, there are chances that 20% are chances that it might subside after few days or few days. You may develop irritation in between, or you may get irritated because of the scratching and the itching. But I think
Hmm.
it's you can say 80-20. Thank you.
And what are the chances of reoccurrence?
Reoccurrence are always there. See,
Hmm.
even if he takes the treatment, and suppose after few days or few months he gets exposed to the same allergen, he might develop the allergy. Suppose I have a patient who is allergic to say X medicine, and inadvertently or he or some other doctor may gives him the same medicine, and develops allergy. and he's allergic to sulfa group of drugs. So he will develop a rash exactly on the same spot where he had developed a few years back, or a few months back, or a few days back. So allergy you can get allergy, repeatedly. It tapers down, not necessarily it continues throughout the life, because our life is a dynamic thing. Things keeps changing. Body develops its own mechanism, mind develops its own variety, and the whole idea of mind and body is to protect us. So it helps, and the patient also patient also realizes what he should do and should not do, what he should eat, should not eat, what should medicine he should take, should not take.
Right. So basically, understanding your body, understanding yourself is very much important. Make sure you're doing that. Make sure you're giving yourself some time. As doctor has already mentioned, give yourself some time and try to understand from within. We'll quickly answer a few questions which are coming from the viewers, doctor. The first question uh, comes from Ria Sathi, who asks, how does urticaria appear on the skin?
See, urticaria appears on the skin because there is an immunological reaction, and the
Mm.
histamine is released. There is something known as mast cells, which are the powerhouse of histamine. And there's these mononuclear cells, these mast cells, and they are the linings of the endotracheal tubes, or even our entire GI system, or on the skin or the blood vessels. So these mast cells, when they get which contains histamine in its granule form, histamine is released, and there is vasodilatation, and the fluid which oozes, and it gets settles into the. There are three things which happens. One, because of the degranulation, histamine is released. Because of histamine is released, the endothelial cells contracts, and the fluid is expressed between the cells. So you get redness also, you get flare, which is erythema beyond the local erythema, and the swelling that is known as wheals. You will find a swelling like in dermographism. You can literally, if I write S on the back of a patient, so who has got allergy to physical urticaria, you can write. It is called as a writing. So this is how it is triggered. Miss, she's rightly asking, how does it happen? It is degranulation of the mast cells and the release of histamine. Thank you.
Right. The next question, doctor, comes from Abhi Kumar, who asks, can exercise cause urticaria?
Accessories means,
Exercise. Can exercise cause
yeah,
urticaria?
exercise. It is known to cause urticaria. Exercise is known to cause urticaria. You can get urticaria because of it is known as physical urticaria. You can develop rash all over the body. So you have to tone down, you have to relax, preferably take bath, and if it is very severe, then go to doctor, take medicines. And if you give me a moment, so I'll definitely like to read out certain things for the viewers, which is based on, which is related to exercise, and I would take your permission to read it out from the from the page.
Absolutely, absolutely, doctor.
See, exercise induced urticaria also, and this is known as exercise induced anaphylaxis. That is a very severe form of urticaria. Patient develop pruritus, that is itching, urticaria, respiratory distress, and hypertension after exercise. Symptoms may progress to angioedema, that is a deep swelling in the laryngeal edema or bronchospasm. It is associated with different kind of exercise. Although jogging is the most frequently reported exercise, act as a physical stimulus that through an unknown mechanism. See, this is what I wanted to read. That through an unknown mechanism provokes mast cell degranulation and elevated serum histamine levels. In contrast to cholinergic urticaria, as the question was asked, yes, it does causes mast cell degranulation, and you can develop urticaria, a very severe urticaria, and even an anaphylaxis. So one really moderation is the key word. See, in every activity or life, what one has to trade is a middle path, or I would say moderation. Thank you.
Thank you so much, doctor. The next question comes from Kiara Chauhan, who asks, how does temperature affect urticaria?
Temperature, when it is heats up, and there are two types. That is solar urticaria. It is said that still that antigens which is developed can mediate IgE reaction. It will be recognized as a foreign thing, antigen, and antibodies are formed, and then they sit on the mast cell receptors, causes the degranulation, histamine is released, and same pathology is followed.
Right. The next question comes from Anuj Kumar, who asks, "What is cold urticaria?"
Cold is same. What you said, which is applicable to hot, same is applicable to cold. That is also known as cold water, aquagenic, which we discussed. And
Right.
it is basically a sensitivity of that patient. See, what is the difference between allergy and what is the difference between urticaria? No, sir, it is basically hyper. They are related, but they are not the same. Okay, it is that hyper response. There, say some patients may develop allergy to cold, some patients may develop allergy to heat, some patients may develop allergy to X tablet, some patients may develop allergy to Y tablet. So it is all individual and your immune system specific. Ultimately, whichever kind of urticaria is there, there is a degranulation of mast cell which releases the histamine. Histamine is released, then it has its cataclysmic effect depending on the severity of the trigger.
All right.
Thank you.
Doctor, the last question comes from Sona Sharma, who asks, "How does urticaria affect children differently?"
There are some urticarias which are found to be very common in children, especially milk and milk products. Milk and milk products, and there is some one condition known as cutaneous mastocytosis. In cutaneous mastocytosis, there are these mast cells which are numerous in numbers, whether it is in spleen, skin, or liver. And they can cause rashes on the body, and that is commonly seen in children below the age of 2 to 5. And they can also trigger the same pruritus is there, redness is there, erythema is there, wheal is there, scratching is there. Ultimately you are going to scratch, you are going to itching is going to be there. It is you may have other symptoms also, like you may develop fever, you may develop vomiting, you may develop a headache, especially in allergic rhinitis, whether upper respiratory tract is involved. You may develop watering of the eyes, watering of the nose, red eye, swelling, nasal stuffiness. That is known as allergic rhinitis, which we call it as allergic rhinitis or allergic conjunctivitis. You get allergy of the bronchospasm also, bronchial tree also. Thank you.
Right. So, this was the last question from our viewer today. We had a wonderful discussion today, Doctor.
Thank you.
Before we take a
Yeah.
leave, any take home
Mm.
message for our viewers who has watched us so far?
Thank you so much for patience listening. And my takeaways, which I tell my patients here. See, basically, uh, what are your thoughts? You have to audit, I would say. What are key thoughts which are dominating you, whether they are resourceful or they are unresourceful, whether they are making you happy or they are making you jittery. Because the thoughts which we have in our minds, they will trigger most of the problems. So if one negative thoughts are there, ultimately you will get some or other problems on the skin or on the in the body or on the body also. So you have to be very careful. What is your quality of your thoughts? So my takeaways is that please observe your thoughts. Please keep them in a resourceful spectrum. Don't worry, be happy. Thank you.
Right. Well, that was the expert advice for today, and that was Dr. Tushar Jagtap for us. Thank you so much, Doctor, for your valuable time. It has been a very informative session for our viewers today, and I'm sure they will use this piece of information to prevent themselves and their near and dear ones from getting urticaria. And in case they get to see such symptoms, they now know what to do instead of self-medication. It's always better to approach a nearby dermatologist. It was great to hear from you, and we look forward to many more such sessions in coming time. Also, thank you, viewers, for your excellent participation in today's session. And to get latest update on how to keep your skin healthy, do like and follow our FB page, All About Skin Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you. Stay safe and stay healthy.
Thank you so much. Thank you.